When I see Francis, I always get up. I always tell people, everybody, when I was doing the fatherhood movement, this sister was out there in the neighborhood, and the work she's doing now, she was doing it for free, helping out in the community. So, what was that, in the early 90s? Yeah, so we go way back. I look up, Francis was always helping. I'm telling you, director, and then you look around and say, Francis, and then she's gone when it's over with. She's never stayed for any accolades. She
That's
just
right,
did the
that's
job,
right, yeah.
and Francis would do the work, and then it's pew.
On to the
She
next
said,
one.
Kev, I'm gone. So anyway, ordinance number 400, 2024, by council members Conwell and Griffin, by departmental request, is an emergency ordinance authorizing the Director of Public Health to apply for and accept a grant from the Ohio Department of Health for the Title X program, authorizing the Director to charge and accept fees, entering into one or more agreements to receive payments from Medicare, Medicaid, Medicaid Health, was HMO, and other third-party insurers, and authorizing contracts with various entities, requirement contracts, professional services, and advertising contracts necessary to implement the grant. Sir?
Thank you, Chair, and thank you, City Council, for this lovely morning. With me today are Commissioner Francis Mills, Commissioner of Health, and our Director of Nursing, Nurse Practitioner, and Dr. Jeannie Johnson-Brooks. And so this is, as you said, an ordinance that would allow us to continue to accept funding from the Ohio Department of Health for our Title X program that allows us to run excellent clinical programs out of our McCafferty Clinic and our J. Glenn Smith Clinic to offer same-day access to low-cost, low-barrier reproductive health care, such as STI testing and treatment, birth control, pregnancy testing, and whatever else comes in for where we can be helpful. And with that, any questions for the experts here?
Yeah, I need J. Glenn Center and the other health centers to be more, especially with Glenville, because we have inside of Glenville, there's Metro Health. You and I were there for the ribbon cutting.
Yeah.
So how can we be more inclusive or integrate services with the children, the students at Glenville High School? Because it's correlated.
Yeah. Want to talk about the Teen Health Summit?
Yeah, that's what you were
great,
saying.
great.
Through the chair to the councilman, we did have a teen health summit where we went to the professional health buildings, and we partnered with Cleveland Municipal School District and provided services, educational services on our STI, prevalent STI for the teens, as well as gave them made a video of what a teen visit looks like. We meet with the school nurses, and we meet with them on annual basis. We come to their school meetings, and we go talk to the school nurses as well about our services. And we do see quite a few teens in our health center. That's why we changed our hours, because they were cutting class to come to our class, to our clinic. So we did it. We changed it from 4 to 8, so teens were able to come to our clinics. We did a lot of videos like on Channel 20 and a lot of media posts, especially one of the key things we want teens to know that they don't need their parents' consent to come to the clinic. A lot of times teens might feel they have to let their parents know, so we are getting that word out as well with our mobile clinics as well. We travel to the rec centers 3 times a week, Michael Zone, Thurgood Marshall, and Zelma George, and we're there Tuesday, Wednesday, and Friday of every week, and we're there from 12 to 3, and we're giving services to the teens and people who frequent the rec centers as well. But that's our goal. We want to increase our awareness and our presence for teens.
You ever thought about partnering with, let's say, Case Western Reserve? They have a dental school and they do outreach. And if we were to partner with them at the same time, or even MedWorks, as well as MedWish.
To council, we have a strong relationship with MedWish, and so 2 of the things that we do in the community, first with the mobile unit, we just recently hired health outreach worker, and so she will be working on behalf of the reproductive health clinics to go out in the community and expand our reach into the community, particularly with young people. The second piece is that we're able to, while we're at the rec center, we're able to provide some on-the-spot education that'll not only allow people to get services on the unit, but also point them back to additional services to the health clinic. So MedWish, we've had a partnership with them. And then we have a significant outreach to the community when we do our monthly food distribution. So those three areas help us to expand capacity with what we're doing with the clinics.
I'd like to have, to Joan Messeline, let's say, for example, when you put a flyer out, that the council members, that we can help, and that we can put it in our newsletters, okay? And as you know, I walk my ward constantly. You've walked with me, and you walked with me in the 90s when I wasn't even a councilman. Even if I have flyers, you say, hey, Kev, here's the flyers that we have. Can you get it out to the residents? Or even at our community meetings. For example, sometimes you have time constraints when you give it to someone to put it in their newsletters. But what we can do is that as council members, we reach out to our residents. We could give it at our community meetings. You've been to my community meetings. We could put it in barbershops, beauty shops, whatever the case may be in the neighborhood, or when we visit our street club, block clubs, if we had some flyers here, and if you passed it through Joan Messeline, because I want to do the outreach. Any questions before you go upstairs?
I do. Have questions.
Councilman?
Thank you, Mr. Chair. Through the chair, so there's 14 sections in this to accept the money, and usually when we're just accepting money, there's like 3 sections. Like Section 1 accepts the money, Section 2 tells what fund it's going into, and Section 3 wraps it up.
I like that.
So reading through this, Section 6 through the chair to the director is authorizing you to employ consultants. Through the chair to the director, could you explain why consultants would be needed in accepting this money from the state?
Through the chair to the city council, so that allows us to flesh out our staffing when we have regular time staff who we don't have on board. So extra nurses, extra lab technicians, pharmacists, to be able to offer a full range of services.
And then through the chair of the director, so most of this is talking about purchasing materials, supplies, and the ability, the authority to write those expenditures. Through the chair to the director, what percentage of this will be used for staff, and what percentage do you think will be used for supplies and materials? Like how many folks, I guess, do you expect to be able to hire with this? Or is this currently employed?
Through the chair, through the chair, this has been ongoing for many years, 14 years.
14 years.
Thank you. And so it's a mix of staff, of contracted staff when we need it. It's the supplies, healthcare supplies, being able to pay for maintenance in the clinic, pays for our electronic medical record. And so that's why the length is there, is because we're running an entire clinical institution through this annual piece of legislation.
Okay, then through the chair, so then Section 10 to the director is for radio and TV ads. It seems like the 650,000 is getting spread pretty thin here. We're going to be able to do all this stuff with 650,000?
Through the chair, we've been doing it for 14
Really?
years, as you heard, yeah.
Wow.
And hopefully
Stretched
through the
dollar.
chair to the council, you've all seen the billboards of our low-cost reproductive health care throughout the community, through the here, there, everywhere mobile units that are running right now. And we also do some great radio advertising with Radio 1 and other partners.
Okay. And last question, maybe to the chair. Section 11 authorizes the director to extend this during the grant term. I believe that would sidestep legislative approval. If we've been doing this for 14 years, I guess the question maybe to the chair is it acceptable to have the director be able to renew this in the future without us? Should we amend that to include legislative approval? Or through the chair to the director, is that the way you read Section 11 as well?
Yeah, through the chair, I mean, this is a program that's consistently delivered phenomenal results for our community, and it's not, at least in my opinion, controversial at all. So I don't know why we would add that.
Not
Yeah.
controversial. I think the question to the chair, though, is I believe we normally review these legislatively and sign off on approval, and I believe that Section 11 would prevent the need for future legislative approval, because it would just, the director would be able to extend it and just do it in-house. And the question to the colleagues is, do we want to give that to the director, or do we want him to come back in a year or two and just do this again, just so we keep an eye on it? It's
Through the chair, it's through the grant term, and the grant term is time-bound. So this is a new grant term, but it's, I think, every 2 years is our grant term.
through the chair of the director. So this is during the current grant term.
The
to
one we're
extend
just accepting
during
now.
this grant term.
Yeah.
I see.
Yeah.
Okay.
So we're
That's a-
back every, I
Then
mean,
that's a reading issue.
I've been with the office for almost 2 years, and this is I think, my second time up here at the table talking about this particular grant. So
Yeah.
we're here frequently talking about it.
Yeah, to answer the question, you need to, I want to keep it consistent, that when they come back, that they hit their goals and objectives, so I can make sure that it is monitored, and I don't want to set a precedence for any other proposals. And the main thing is that I need to see that their goals and objectives are being met.
Yep. And through the chair, we're happy to come and do a presentation at any point dedicated to the programming, because they've done incredible work. We've, our public information officer, Richard, in the corner over there, put together this great video of that Teen Health Summit, and we'd love to show you all
You wanna see
that.
it?
And so we definitely could aim for that in the fall at
'Cause
the
you know-
Future Health Committee.
You know, the thing about policy, your policy intentions sometimes might end up steering away from your policy objective. So if I don't monitor and control, your intention is to do, let's say, over 2,000 patients receive family planning counseling, but you might only hit 1,200. But your intention is to hit the 2,000. But therefore, you don't hit your objectives, and I'll never know. So I need to always know, because those things are two different things, the intention versus the objectives.
And through the chair,
I'm happy to report that through the work of Jeannie and the rest of the staff, we were able to meet our goals to the 97th percentile. And the work of the Teen Summit was so impressive to the staff at the Ohio Department of Health that they invited Jeannie and her team to come out and give a presentation in July around how other health districts can put together teen summits in a similar fashion.
Yeah, but if I had an evaluation process, Commissioner, where you can evaluate what you guys are talking about. For example, you have here over 2,000 patients receive family planning counseling. This is what I know. You have 2,000, it's not all the same. So you have an individual service plan for each different family, because it might be something different. But if you tell me here, over 2,000 patients receive family planning counseling, it's fragmental, because you're not giving me the evaluation of it.
through the chair, we can send you the results of our annual audit from the Ohio Department of Health that reviews our numbers.
Okay.
And then, like I said, present it. It's a great group, and then they can present the
Right,
the
but
work.
to
Yeah,
have oversight, you
Yeah.
have to have a good evaluation.
Sure.
And that's how you can get more dollars. And I yield back to you, Councilman.
Yeah, thank you, Mr. Chair, because I'm still a little bit confused about the grant terms here. So the grant term was April 1st of this year to March 31st, 2026, which means we're already in the period of this grant. Through the chair of the director, has this grant already been accepted?
Through the chair, it can't be accepted without this legislation. So
Okay.
it's common practice from our beloved colleagues at the Ohio Department of Health to give us word that
Sure.
we've been accepted for the grant a day or two after the grant period starts, and then we go through the process of setting this up. So
Understood. So, but to the chair then, so section 11 does go back to 2026. So I believe through the chair, if I'm reading this correctly, section 11 means that in 2026, we don't have this conversation. The director just simply approves the next grant during the grant term for the following 2-year cycle, and we don't have this conversation at the table because I believe section 11, the director of the public health shall have the authority to extend the term of the grant during the grant term, would be during the current term that we are in right now. The only way to extend that is the 26 to 28.
through the chair, it's this legislation is to accept for this grant term, and it's a 2-year grant. So we'll be back in 2 years or less than 2 years to
Okay.
accept future funding.
Okay. If, I'm trying to wrap my head around these revolving, I mean, it's always good, hey, for the record, happy to work with the state, happy you're doing the work, glad to accept it, just trying to understand the process, because sometimes these grants that come through are like 3 sections long, and this one's like 14 sections
Yeah.
long, and I'm trying to read this and understand why this has so
Yeah,
many
through the
more sections
chair.
involved. Part of it has to do with because it's healthcare,
It's
so you're dealing
healthcare,
with
right.
clinical issues.
Right.
Part of it's because it's dealing with staff, so you've got staffing issues. And then there's a section in here for advertisement, and perhaps you're just doing a wider range of things with this money, and that's why you need more sections in this than I'm used to seeing.
Yeah,
in what
and
is
you can,
essentially a grant.
through the chair, you can pull up the last one as well to
Okay.
get a good comparison, but yeah, no.
If the
But yeah,
chair's
through the
ready to
chair,
go-
we've got to go through all the different insurers and that sort of thing, and so it definitely adds complexity, but
If the
team does a
chair's
great job.
happy, I'm happy.
I'm cool beans. I mean, we talked, the director and I, not just at the table, sometime I might call him at 8 or 9 o'clock at night, and vice versa, or 10, we'll call each other. I mean, we've gotten that close that we talk, and I won't even wait for a day or two. Just call. It could be Friday night, or whatever the case may be. And then I'll ask questions, or you send me something, I'll ask you a question.
Thank you.
You know what I'm saying?
Well, that's true.
Yep.
In Senegal, too.
Cool beans?
I'm all set.
Any other questions on ordinance number 400, 2024? Council Lady Deborah Gray.
Thank you, Chair. Good morning, everybody. I just want to have a couple questions. Your name again, I'm sorry?
It's Jeannie Johnson Brooks.
Miss Jeannie Johnson.
Dr. Jeannie
Dr. Johnson. Oh, wow.
Doctor, ain't no,
Yes.
okay.
You spoke earlier that you are in 3 different rec centers,
Yes.
and Zelma George is in Ward 4. So the days that you're there and the hours you've been there?
Zelma George is Tuesdays from 12 to 3. Michael's Zone is, I believe, Thursday. And then Thurgood Marshall is Friday.
Okay, and from Tuesdays from 12 to 3?
All of them are 12 to 3.
12 to 3, so
Yeah.
you have different representatives there. And where are they located at Zelma George? Are they,
We're in our mobile clinic.
oh, your mobile clinic?
Yeah, we have a mobile clinic.
Mobile clinic
Yes.
in the parking lot?
Yes.
Okay, all right. I wasn't aware, I'm normally there on and off, but maybe I wasn't there during on the Tuesday between 12 and 3.
Through the chair, it's brand new, and
It's
we've
just brand new?
had to
Okay,
send it
just
back
started?
for a few warranty recalls, and so,
Okay.
so once we're there in a steady pace, you'll be hearing a lot about it, hopefully.
Okay.
Yeah.
All right,
thank you.
okay. And what do you provide from that mobile clinic to the, to the community?
We provide reproductive health screenings. We do like a urine-based test for chlamydia, gonorrhea, and trichomonas. We do blood tests, finger stick for HIV and syphilis. We do contraceptive counseling. And we do a lot of referrals. If they're doing something if they need something that's outside of the scope of what we can provide, we make them appointments to our health centers, or we just make referrals through our new EMR system, which is eClinical Works.
Okay, wonderful, wonderful. I'm just impressed with that because I was going to look and to see how I can get the mobile clinic at all 3 rec centers, not only Zelma George, which is the main HUD in Ward 4, but also at Hamilton and Woodland Rec. We're trying to encourage more programs and activities at all 3 recs where all the communities can come out to the rec centers so they can be more engaged to understand, what can be offered in those areas. So I'm just glad to hear this is happening. But I also wanted to talk about, this is 400 2024, correct?
Yeah.
Yes. On here, you have administration ordinance summary Title X program. Could you extend on that a little bit, either one of you guys?
Sure. Title 10 is a program that provides reproductive health services and family planning. And so that's a designation for all programs that receive this type of funding. So that's why it's called Title 10.
Title 10, okay. And because here at the bottom, you have accomplishments, 4,500 patrons seen in RAC, 350 telehealth visits. Is that something that you, and so on and so on, and that's something that you're going to incorporate with, you have the teen wellness clinics, Tuesdays at John Glenn Smith, and Thursdays at McCaffrey from 4 to 8. Is this something that's going to be part of the Title X that
Yes.
you're going to incorporate at these 2 clinics?
Yes.
Okay. All right, so that's it. That's all the questions that I have.
All right, I have one statement to make. Francis, Commissioner, you, is a longtime friend of yours. Are you still out in the neighborhoods? What I like a lot is that, and I won't be long, you gotta go. No. Well, let's vote on this first, and then I'll make my statement. Any other questions on ordinance number 400, 2024? With that, so approved.
Thank you.
All right. Francis, you still out in the neighborhood, in the community?
Not as much as I used to be.
Right.
As you rise up in the ranks, you're in the community in different ways. And so
Right.
you might not see me at every event like you used to see me in the evenings and on the weekend.
Right.
But I make sure that staff is available to the community. But I do additional work with organizations in the community in terms of committee participation and board operations for local community agencies.
Do you know,
What do you need?
You know, you're gonna have to champion, you guys push this education piece out, because it's education first. You know, the people know you, and you're gonna have to reemerge, and you're gonna have to help champion it, because it's about people that people know. And so that's the first thing that's going to have to happen. The second thing is that little, especially young African-American females, especially from Glenville, Hub, Fairfax, whatever the case may be, they got to have an up-close view with you. They need to see you, know you, and know in the health department they can do other things in the health department also, and become doctors, whatever the case may be. They're going to have to see you.
Agreed, and I wish that we had the whole team, because our administrative clinical manager is also an African-American female, and then our new health outreach worker, her name is Octavia Jones. She's a energetic person who is also a community health worker, so she knows and understands the community. So we have a great team of not just clinical staff, but clerks and outreach people on these efforts.
Because, you know, children have to see success every single day.
Absolutely.
They got to see you, and they got to see the doctor, especially, you know, we just had Mother's Day, but the outcome measures is that in order for them in Glenville, Hub, Fairfax, all these places, and you know it, and for order for them to grow, they got to see you.
Amen.
You know, they have to. And doctor, because I didn't know that you're a doctor, and then it just came to my mind. Some people want to be MDs, and some, and they don't know, like at Cleveland Clinic or University Hospital, they might just think being, well, I don't want to say just might think, being a doctor or whatever, but it's other kind of services in there, accounting, finance, marketing, real estate, purchasing and procurement, all those kind of things they could do. But in my neighborhood or in the other neighborhoods, they don't know that unless they see you sisters still there. You see what I'm saying?
I do have one more question.
Yes, Councilor.
Thank you. I just have one more question. The Title X, you know, a couple of years ago, Planned Parenthood was trying to get Title X passed, part of their incorporating of what they're doing. Is this similar to Planned Parenthood, Title X per se?
Minus the abortion services?
Yes, minus
It's
abortion
pretty, yeah,
services.
pretty much
Pretty much
reproductive health, yes.
Okay, all right, okay, because I was out there, activists, working with them on this, and minus the abortion services. That's that's when I read this. This is what they had incorporated with them, and we were out there activating that part of it. That part of it. We also went to the office
But we collaborate a lot with
You
Planned
collab-
Parenthood, yes, like
Okay.
with if they have a positive like syphilis result or something that they don't have, there's a shortage of bicillin, they send their patients to us, so we
Okay.
do a very good relationship.
Okay,
with
so your relationship, are you partnered with them? I believe they close, I think the clinic is still open on 79th and
Yeah, it is. It's
Church
still
Place?
open.
Church-
It's still
church.
open?
Yeah,
So
right
do you,
across from Church Square.
okay, so do you collaborate with them?
Just on information and referral basis right now, but we plan to strengthen that
Okay.
partnership. But we do, they pick up the phone, I can pick up the phone, and yeah, it's a thing. Especially if it's a patient in need, it's hey, how can we help? Help
Okay,
each other. So,
all right. I kept reading it, and I was like, I remember this when I was out there with them campaigning for that, minus the abortion part, and that part that
She
it
said
just
the
it just
abortion
clicked.
part.
And so, because I am a member of Parent Parenthood, and I was down on 79th when we gave the classes and started administrating the information. It's just been such a long time that I went over this, and it just kind of clicked what you're doing in it. So yeah, this is going to be great to put back out and bring back out into the community. So thank you for this.
And
Appreciate
one
it.
of the things that you have, council members, that I always like to continue to say, there is nowhere in the city of Cleveland where an individual can walk into a clinic with a same-day appointment and get seen. They can
Get their
get
medicine.
treatment and get their medication. You can't do it at any of the hospital systems, and it's unlikely that you'll be able to do that at the FQHCs. But at our health centers at McCafferty and Jay Glenn, you can walk in, get seen, get treated, and get help.
Yes,
So
definitely. I want to agree with you on that,
Yes, healthcare
Chair, to the committee. I know that the Parent Parenthood clinics, they provide all services for everyone. You can walk in, get the same services as your primary doctor, and that's what people need to understand. It's not only an abortion clinic. It's for all health reasons, and they need to understand that. That's why we have them so spread it out, through the city of Cleveland, and they need to understand that these services are free.
Thank you.
Yes.
Okay.
All right, we're going to bring our
Councilmember Hars
association
wanted
teams.
to make
Okay.
a statement before he
Great.
goes.
Yeah. Mr. Chair, I have to run upstairs to the Board of Zoning Appeals where I have a case impacting some neighbors that I need to pop in and do some of my council responsibilities. But I know that we're getting ready to have a presentation on smoking, so while they get set up, I just want to say something very quickly for the folks at home or for my colleagues in case I don't make it back down while this presentation is still happening. And first off, Mr. Chair, I do not sit high enough to look down on anyone in this world. Smokers are my people. I was a smoker for 25 years. My mom just quit for the first 3 weeks of her life after 50 years of smoking, but I come from a long line of smokers. I understand the appeal and the attraction, and I understand the comfort that smoking provides to a lot of people. But I will say, Mr. Chair, that smoking is one of the most expensive addictions that affects our community. Smoking costs $2,000 a year, whether you live off $15,000 or $115,000 a year. And if we had the opportunity in this body to lower rent by $160 a month for 35% of Clevelanders, every single person in this body would vote yes.
Yeah. We did.
The addiction to smoking costs low-income Clevelanders the most because they have the least to lose, but it's one of the financial attacks against our community. I grew up in the 80s, and my dad took me to the racetrack when I was young where they gave me a poster of a camel, and the camel was a cartoon character flanked by two, I would say, bikini ladies. And I had that poster on my wall when I was 12 years old, and I thought that smoking was cool. And smoking has had a grip on people's concept of cool, which I'm sure they're going to get to, for decades. And unfortunately, it causes young people to make foolish decisions that then we spend the rest of our lives trying to get past. And Mr. Chair, I wasn't able to quit smoking until I realized one day that I didn't want a cigarette because of the effects the cigarette gave me. I wanted a cigarette to avoid the effects of not having the cigarette. And that's what addiction is. Addiction doesn't get you hooked to something because it feels good. It gets you hooked to something because not having that substance makes you feel bad, right? And it takes a long time for somebody who's addicted to something to make that mental flip and realize that you have to get past the withdrawal symptoms to feel normal, and the normal isn't the substance. The substance is making you feel abnormal by denying your body the substance. That's what addiction is, I think, at its core, and the doctors can correct me on that.
You got the doctors up.
But it is a brutal thing to go through, and I look down on no one. I cast no shame or doubt on anyone for their choices. Cigarette smoking is certainly not violence in the neighborhood, but it is a costly decision that is typically made in youth that then you spend the rest of your life trying to deal with, both financially and socially. And I encourage this body to embrace efforts to reduce smoking rates, particularly when they target children. We as a nation banned those cartoon ads that were used to target me. Joe Camel was illegal, and they can't advertise. We actually banned cigarette advertising on TV, I believe, because it's so
Yeah, we did.
it's so attractive and it's so easy to tell kids that this is cool. So I encourage this body to embrace this information with open ears and think about the financial impacts that this decision has on our community. And it's $160 a month. And if we could lower everybody's rent by $160 a month, we would do that, wouldn't we? Yes, we would. So that's all. Thank you, Mr. Chair. I will try to be back while this presentation is still happening, but you know how zoning goes. I could be there for 3 hours.
Yeah, take care of your ward, man. All right. See you later, Councilman.
You guys want to slide, you want to be centered, a little more centered? We'll slide over one. We'll slide down one, yeah. Props here for everybody.
See, I told you I would open this up.
I love it.
When I saw
appreciate
you, I said I'll open it up,
Appreciate
man.
you. Although sad Councilman Starr, Councilman Moore are here. Councilman Jones.
Well, Councilman Starr is out doing something, man.
That is something.
Yeah, I talked with him 2 or 3 times over the weekend. We talked.
All right. All right. To the chair,
What's this?
thank you for the honor of presenting
Breeze.
to you.
What the heck, what's that, man?
Yeah, these are all, what you've seen on the table are different flavored tobacco and flavored
I know
vape products.
about Marlboro, man. We were out of
Yeah,
jazz
that one's the
cat.
one not flavored, yeah.
Yeah, just a lot of my friends would smoke this.
So with me today to talk about smoking cessation, smoking education, the work that we're doing in the health department and the community is our Director of Community Health Initiatives, Catrice Miner, and our Health Promotion Coordinator, Prince Pempton, who's a Glenville High grad, just throwing that out there.
Are you top letter?
Yes, sir.
You graduated from the field.
02.
Oh, too? So you back there with my son.
I went to Kent with him too.
Yeah, you went to where?
Kent with him as well too.
Yeah, you know my son. Yeah, when you said 02, I'm like you back there and Ginn and the rest of those guys. Teddy Ginn. I used to go up there. Yeah, you from the neighborhood. What part of the field?
111 by Parkwood.
Yeah. We getting ready to build a new building over there.
Oh, really?
And
Okay.
we break ground and build this summer with VA coming up to that end of Superior. And then off of Ansel, we have another building, Hitchcock Center for Women.
Okay,
You know
yeah,
about that?
yeah.
27.5 million.
June 6th.
We're building it, so the Ville is,
It's growing. It's changing.
yeah, it's changing, man.
Love to
It's
see it.
growing.
And
good.
through the chair in the audience, we have Dr. Erica Trappel, a professor at Case, who's done a lot of the great work on smoking policy here and throughout the country. And to her right is Jerome West, who's the director of the smoking cessation programming at Metro Health, who hopefully later on in the presentation will have a chance to talk about his journey and the work that he does.
Right. Prince, they probably want to see you over at Glenville.
Okay.
You come over there and you speak, you talk with the children and with Jay Glenn Center, the whole 9 yards. Up there at Martin DePore Center, you know, all of that. And even around where Case is at, because that's in our neighborhood as well. So they'll, be top blooded.
Oh yeah, I'll do it.
So,
Through the chair,
yeah.
Patrice Miner.
So I'll get us started, and thank you, Director, and good morning to the Council and Chair. Thank you for having us. As Director said, my name is Catrice Miner. I serve as the Department's Director of Community Health Initiatives, a role I've held since December of 2022, and one that follows nearly 2.5 years embedded with the Department through the CDC Foundation, where I provided communications and outreach support throughout the pandemic. So as you know, the department is divided into 5 different divisions. Our work in community health rests within the administration division, And our primary goal is to engage the community on pressing health issues such as heart and health, health literacy, and the topic that we're here to speak about today, tobacco. We are a team of two. Prince, to my right, is our health promotion coordinator, and you'll hear from him in just a bit. I also want to just add, before I go into tobacco, that the work that we do also has an inside-outside approach, where in addition to engaging the community, we carve out time to serve on our department's employee engagement work group, and Prince's work promoting health extends to our colleagues as well as to the community. And monthly blood pressure checks and lunch and learns are just two examples of some of the work that we do within that work group. But back to tobacco and the what, the so what, and now what. So the what, I want to point out a ratio, 1 in 3. I think this is information that's pretty well known, but approximately 1 in 3 Cleveland adults use tobacco products. And you can see from the slide, 84% of the city residents live within a 10-minute walk from a tobacco retailer, and 77% of Cleveland public schools are within 1,000 feet of a tobacco retailer. And Cleveland is home to 36 times more tobacco retailers than McDonald's. So in addition to it being prevalent, there are also some wicked health outcomes that come with smoking. And you can see from the slide, smoking leads to disease and disability and harms nearly every organ of the body. So when we talk about death and disease, cancer, that's cancer of the lung, mouth and throat, waste box, stomach, kidney, colon, liver, bladder, just to name a few of the many, many cancers that can be caused from smoking. And this is from the CDC Foundation. If nobody smoked, 1 in every 3 cancer deaths in the US would not happen. Okay, and then layer on top of that the mortality and morbidity that comes from secondhand smoke. And if you're not familiar, third-hand smoke, that's the residue that's left after a person smokes and it clings to the wall, to your hair, to your clothes. All of those are health outcomes that are plaguing the city. So that's why we approach this in a multi-pronged approach with a multi-sector initiative. So that leads me to my first task as Director of Community Health Initiatives, which was chairing a multi-sector tobacco cessation work group. And very early on, after conducting a sort of community asset scan, we found a need to make improvements in 3 areas. So those 3 areas were to increase the awareness of available cessation resources, because there are cessation resources available in the community. But we also wanted to make more resources available if folks decided to quit tobacco. So we wanted to make some more community-based cessation programming available. And then the last part is to increase the readiness and remove access to barriers for cessation services. And with all of that done, plus other work, we'll be able to prevent and decrease tobacco use, and Clevelanders will have longer, healthier lives. So with that in mind, I want to...
So you know what, let me go back.
Sure. To this one?
No, move forward a little bit.
Okay.
Just go back. The aims, your objectives.
Yep.
Increase awareness of available cessation resources. You're going to bring us in how you plan to do that, right?
Yep, that's next.
And, increase availability of evidence-based tobacco cessation programs,
Also happening, that's next.
implementation.
Yep.
Don't worry with me. I got it.
Oh, no.
I have to see dependencies.
You have to walk it like you talk it. Somebody said that to me one time.
Is it on the script?
Right. Okay. So,
Key of minor.
in the key of minor. Before I turn it over to Prince, I just want to talk a little bit about his presentation, which he put together after joining the department in March of 2023. There is a heavy emphasis on menthol, and there's a few reasons for that. One being that menthol is the only characterizing flavor in cigarettes not banned in 2009 when they made the ban. So of all the flavors that remain for cigarettes, menthol is the one. And approximately 85% of black folks smoke menthols.
They do.
And then on top of that, youth who use nicotine-containing products prefer menthol flavoring. And then there's the whole equity piece. So I will turn it over to Prince to talk about some of the work we're doing around tobacco cessation that gets at raising awareness and also increases readiness and access. He's going to talk about the presentations that he put together and then show you some of the collateral material that we developed. So, Prince?
Need the clicker.
Oh, you need the clicker. Yes, you do.
Morning, council.
Hey, top letter.
So these are a few excerpts of my presentation I've done at CMHA, Cleveland Clinic, and the Cleveland Public Library to educate the community on the history of big tobacco's marketing. We all know the harm of tobacco use, right? Lung cancer, throat cancer, stroke, etc. I made it a goal to educate my community, your community, on not only the harm of tobacco use, but how they got people to start using, what a life quitting tobacco could resemble, and available resources to help people quit. Big tobacco has a racist history of using and continuing to use targeted predatory marketing to drive sales and get people hooked. From its portrayal for people having a good time, men looking strong and assertive with a beautiful woman next to them, using specific colors like red, black, green, and yellow in their billboards, to greenwashing menthol in their targeted marketing to make it appear their poison is safe and healthy with words like fresh, cool, plant-based, and farm to store. Me being a vegan myself, calling a cigarette plant-based is a little diabolical. Also, Big Tobacco invested in programs like the Cool Achievers, offering coupons, funding events, and passing out free cigarettes in low-income neighborhoods and pleasure vans were some of their effective tactics. Growing up in Outhwaite projects, I've seen plenty of billboards of Cool, Newport, and Camels. I had candy cigarettes pretending to smoke and saw tobacco use in cartoons. A young, impressionable mind can easily be manipulated into a future tobacco user. These candy and real cigarettes are almost identical. My mother was a smoker. She quit because she didn't want to choose between a carton of milk and a pack of Newports. Quitting is scary but possible with our community cessation program, which Catrice will go into later. Quitting can be a reality. We can help people discover their triggers, replace tobacco use with healthy habits, and prepare them for the difficult journey ahead. I've also developed a resource guide, further providing resources in Cleveland to help people quit. They can scan the QR code and the resources and have the resources at the palm of their hands, hence the name Palm Cards. Let's circle back. I don't want to scare people into quitting with the results of tobacco use, but rather educate them on what happens when you decide to quit. Your sense of taste and smell improve. You're no longer kissing an ashtray or are the ashtray being kissed. Your health improves. You save money that can be put back into yourself, your family, and your community. Thank you.
Okay, so those were just two strategies that we're using to increase awareness of available resources. So the presentation to the community, also the palm card that directs you to different cessation programs that are throughout Cleveland. So another aim was to increase the availability of evidence-based tobacco cessation programs. Thanks to the support of CASE, myself, 3 of our colleagues at CDPH, as well as 6 others, were able to be trained in the American Lung Association's Freedom from Smoking program. So we are now trained facilitators with, where we're able to facilitate courses for 3 years. So this is just a little bit of information about the Freedom from Smoking program. and what we are going to be doing in the community relatively soon. So when a person is going through the pathway to a smoke-free life, it's very important to think about different support systems. Not only do you want to do some type of counseling of some sort, but you also want to be able to have some kind of medication to help support you against the withdrawal symptoms. So the program that we've developed includes both group counseling from our training through the Freedom from Smoking program, but also we were able to get some financial support to be able to provide nicotine replacement therapy to participants of the program. And then we also are going to use some of that funding to develop a quick kit, just a handy something for people to hold on to have them remember the reason and the way to become smoke-free. So the way that we are approaching or will approach this or have approached this is we've developed an online interest form. So residents will be able to go to this website, our website, and express an interest in becoming smoke-free. We will then contact them and build a class around those individuals. So instead of having a session already pre-planned to help with access and other barriers for participation, we are going to find a location that works for that particular group and build a class around them. And this session is formatted in 8 sessions over a 7-week period. And to make these community-based, we're going to partner with different community organizations to serve as host sites.
You know, have a recruiter.
Well, here, the next slide, promoting the services.
Oh, okay.
Very good segue. So as I mentioned, we have an interest form. So we have it in a palm card. So while individual partner organizations and some of our internal staff are out in the community, they can provide this palm card. Individuals can scan it, and they'll be taken to the interest form, or the interest form questions are right on the back of the palm card, and that information gets back to us. And then we also have had recently media coverage, which really spurred a lot of interest in our cessation services. And we have our partner agencies who are also helping. And then we also had a spot on TV 20 where we were talking about the cessation services that we're providing. So in addition to us delivering the services, the partner sites will also help with promotion. So for example, if we work with, CMHA, we would ask them to help promote the services and include some of their residents as potential participants in the program. So we're trying to bring the services directly to the community where people are asking and needing them. Before I go into youth presentations and programming, I just wanted to make sure everyone had a copy of the palm card so you can see that.
Look at this. Did you see it?
Yep.
All right.
Okay. So that goes towards our goal of increasing availability of evidence-based tobacco cessation programming and also the readiness and access to resources. So the next part of the work that we are doing is around youth presentations and programming, and that area is still more of a work in progress, but I will say, just recently, Prince and I were at a CMSD, thank you, health fair, where we had the opportunity to speak with some youth. We tried to bring more tactile kinds of activities to the table. So one of the things that we did was do you have the tar? So when you smoke, there's tar that builds up in your lungs. And this is kind of a representation of that if you smoke a half a pack a day.
For a year.
For a year. So to help kids understand this, because the amount of tar is written on a packet of cigarettes, but they can't really understand that as much. At the table, we have them make slime/putty, because it has nearly the same consistency as a tar, so they can touch, feel, and understand kind of what is happening in their body when they use tobacco products. And just randomly, I picked 2 different types of body wash. So the formula is body wash and cornstarch. So I randomly picked 2 kinds of body wash, one that's an apple fragrance and one that's just shea butter. Just randomly, but not so, most of the kids that did this chose the apple flavor. And I think it goes to show that scent and fragrance and flavoring really is a draw for youth in a lot of things. So they were able to do this and make putty and really enjoy doing it. So that's one piece. Prince has done a couple of presentations to some schools, and we have more online, and we're in the process of developing a youth program which will have some of these activities and education and talk more broadly about lung health itself. What we also do with youth is show them like some of the vape products that are a little inconspicuous. So this looks like an Apple Watch, but this is actually a vape.
What? That's a vape.
It's a vape. And before I had trouble opening it, and Prince will assist me. Vanna White.
Oh, snap. Wow.
So that's just one item. It's a watch.
Where you get this from?
Just about anywhere.
Yeah, to the chair, all of our neighborhoods in Cleveland,
Yep.
unfortunately.
So they have watches, they have highlighters, they have a hoodie.
I know you haven't seen this. It's our conservative councilman. I know he
Asthma
hasn't.
inhalers,
Asthma inhalers,
coffee mugs
coffee mugs.
Coffee mugs.
Yep,
You have coffee mugs?
that are vapes, yeah.
that are vapes. So there's a lot to know, and we're trying to do our best to make sure youth understand what is happening. And we also had the opportunity to work with some students who came up with some other ideas for helping to prevent youth from starting smoking. Because that's the most important piece when it comes to youth, the prevention piece. Because Big Tobacco wants you to start early, so they try to entice you with things that are more attractive to you.
Wow. Wow. You see this council lady?
So you can definitely touch and feel and look at any of the items that we brought with us. That concludes the prepared portion that we have for you, but we are open to other questions unless either of you want to add anything that I may have
Question.
missed. Yep.
Let me ask you to Dr. Margolis. They're going downstate. You know, with your state reps, state senators, in politics, it's a cash game. And the average person do not have money to have a lobbyist. So they're going to go downstate, and they're going to, I remember when I was battling the gun lobbyist, we got a chance to have a victory for a short term, and they watched when I went down to the Senate as well as to the state just to tell them our reason why, how guns need to be regulated. People agreed. A few months later, maybe 6 months later, the legislation came back up again. You know, the lobbyists spread their money around NRA. So what do you think?
Yeah.
Because let me, and I'll yield. What you got to do, where they thinking, I'm thinking political too, the political approach. They got to cut you off at the path. You're trying to do this here, you champion this here, but what they can't afford, even with the education piece, for it to go to Akron, Steubenville, Twinsburg, you know, they're going to fight it downstate, and they're fighting it right now.
Through the chair, thank you. So yes, in Ohio, a number of cities have passed laws to restrict the sale of flavored products. Toledo, Columbus, And I think we're up to 5 suburbs of Columbus have passed legislation. So in response to that, you're right, the lobbyists got busy. They made an attempt to pass a law preemption to prevent local cities from passing their own flavor sales restrictions. The governor vetoed that, and then the legislature got back together and overrode that veto. The good news is that 14 cities, including Cleveland, got together, and we put a lawsuit against the state saying that if the state doesn't have a statewide policy, then how can you prevent cities from having their own? And the judge sided with us so far, which, as far as I talked to, our legal experts, they've never heard of that happening where we've gotten a win against home rule, or against preemption for home rule.
Right.
And so right now, the legislature has done the worst they can do. Hopefully, they'll get to doing a statewide thing, with the new legislature comes in. But at this point, they've done the worst that we can do, and we've won that lawsuit temporarily. And so cities are right now allowed to do it, and there's nothing the legislature can do. So we're, it's a window. Anything can happen, and you're right. Like, more money is going to pour in, but we know what the right thing to do is. We've been doing the work in the community, and people are suffering. People can't breathe, and
It's
so
a cash game. It's a
That's
cash
right.
game. You know what you're going to have to do also, when I go downstate, you got to, when you building key stakeholders and you start pushing the education project forward or programs forward, you got to have people to go down there to talk about it. Just can't be you, Prince, and Minor down there. I mean, you got to have other people down there talking about it and talking with state reps and state senators, because it's like, it's going to be, you ever been down there to testify?
through the chair, I have on this issue. They didn't leave any room for testifying because they did it through a budget bill. But to your point, and I want to see if my colleagues have anything to add. In your folder, you'll see a letter from over 50 community partners who, many are watching on TV right now, who've been doing this work, talking to legislators.
That's what you're saying.
And there are legislators on both sides of the aisle that are interested in doing something about it. But in the meantime, people are suffering, and so that's why we're so passionate about this. But I want to see if Catrice or Prince have anything to add,
Yes.
because I ramble.
Well, when I first started, one of my colleagues outside of CDPH reminded me that the city is a battleship and not a speedboat, and that we may move slowly, but we are very impactful. And I think the work that Prince and I are doing and our community partners are doing is impactful. We're educating, we're providing cessation resources, but I think the people in Cleveland need more support. I think they need more support in making their environments more conducive to them being able to go on a smoke-free journey without it being hindered by, ads or access to the products that they're trying to avoid. And after my TV20 stint, one of my other colleagues came to me and she talked about her journey and how she quit 15 years ago. And after that, she started to do tobacco cessation resource or counseling as well. But one of the things that she said that really resonated with me was that, you have to change your environment. And I think it's on us to change the environment for people in Cleveland and not expect them to leave and go to a different environment. So I think it's important for us to go and do some lobbying, but I think we have some tools in our toolkit here that we can put in place that will help people.
You know what I don't understand is that even, for example, your director was talking with me about it, and let's say when the state reps and state senators were discussing this downstate, and Frances was calling me as well, looking at her, I would have pushed toward education at the same time. instead of waiting for them to say yes or no, you push toward education. So, for example, you have the state pushing the legislation, the lobbyists working here, but then your overlapping project, you're in the schools, you're talking with key stakeholders, you're visiting community meetings at the same time instead of waiting to see what will be the outcome. And if the outcome says Friday that the judge from, from Lakeland County?
Through the chair to Franklin County.
Franklin County, let's say they say no,
Yeah.
that he's wrong, I would still keep pushing because it's passion and you never stop. You just got to do it.
Right.
I mean, that's how you win 2 state champions. You just never stop. You got to keep pushing.
I'm not going to bring up my high school, but it has one of the best records in football in the United States, but I digress. I don't think you're wrong. I think you're absolutely right. And I think one stakeholder group that we didn't mention was the Breathe Free Coalition, and they've been before this body before during the times of Tobacco 21. So at the same time that we've been working on education and bringing cessation resources to the table, there are other stakeholders within that larger coalition who are also working on kind of the structural changes that need to happen, the policies that need to happen to support individuals who want to become smoke-free. So I agree completely. Education is important. Providing resources is important. Ease of access is important, but there are some larger structural systems that need to change in order for people to be more successful.
Right. And you have, before Dr. Mongolius came, even the big guy downstate didn't trust our health department. I mean, you pass legislation and then it's set on a shelf. And you guys just did not execute. And I just, I mentioned it to you. We passed legislation. I mean, legislation with your department, they have to execute. And you got to know if you're going to push this education piece, like you brought us something, but it's kind of still hollow. It got to be a plan for cessation that you say, okay, we need to hit these certain dependencies so that we can hit certain milestones. I mean, you show me numbers, but you got to have some way to evaluate it so you know where you're going, and you got to make sure that you have a department of execution. Before you came, Doctor, I mean, you and I talk about it all the time. I mean, you got the baton, but you know what I want to say? Sure. They just didn't execute. I mean, you push something, you say, we want to push this smoking piece here. They're like, that's just health department. They're not going to do it. Because you got other departments in there, they're not executing. And it's not the worker, it's just the culture of not executing that a lot of you guys inherited.
Through the chair, yeah, thank you. And we've got an incredible group of 130 people at the health department. Ohio Department of Health regularly reaches out to us now saying, they're noticing the impact we're making.
They used to
here in
didn't reach out
Cleveland.
to you.
Well, they reached out to us with, yeah, a lot going on. But, our lead program is outstanding. Our food safety program is outstanding. Our clinical services you've heard about. And this program that Catrice and Prince have built over the last year has just been outstanding. So we're doing the work. We have a plan, and we're just honored that you're hearing it today, and look forward to this being the first of many discussions to talk about how we can reduce Cleveland's smoking rate and improve the quality of life for our residents.
Well, Doctor, I want you to educate people on what you're talking about. And if you have any barriers, I want you to educate them, especially in my community, the black and the brown communities where it's going on at. That's what's spiking the numbers. Then I would, you meet with me, that I help you to get in without any hesitations whatsoever. Because I know a lot of the people, and I know majority of the key stakeholders I've been around since you were in high school when I first came in. You were in high school in 2001, and that's when I became the councilman. So,
And through
I
the
could
chair,
get through barriers.
Yeah, I appreciate that. Through the chair, we've done at this point, I think over 50 community events, at least 50 community events. We've done TV advertisements, billboards, a number of events here in City Hall. We've been to community meetings anytime we're invited, or we show up to community meetings and for City Council. And we're going to keep doing that.
Right.
But at some point, it's just like Catrice said, I think what we're hearing from people who are trying to quit or who have successfully quit is it goes a long way to know about smoking being bad, to hear tips and tricks for how to quit, to have someone ready there to coach you, to be able to give you nicotine replacement. But at the end of the day, there are 600 tobacco retailers in Cleveland. There's 4 out of 5 of our schools have a tobacco retailer selling these products in front of you. Within 2 blocks of those schools, kids walking home, they go in to buy, anything in a convenience store, and up and around the cash register, as you all know, are all these different flavored products. This is just a handful of them, and it's really hard to quit when it's always in your face.
That's true.
And so we're going to continue to do that work, but I hope that as we continue talking about this, we can talk about policies to just help make it easier for our residents to quit, like so many other cities have done in this country.
While you're doing the education part, Doctor, you're able to evaluate it, and then when you evaluate your goals, objectives, I don't see Cleveland Clinic on here at all.
Through the chair,
Are
they're
they?
they're on there, yeah.
Where
Let's
is
see.
Mark it? I don't see them
Okay.
on there. One of the pieces that the clinic, as well as University Hospital, is supposed to do is reach out into, especially in our neighborhoods like Fairfax, Glenville, Huff, and every year they're charged with putting money back into neighborhoods that surround them with abject poverty. And we could, you guys could reach out. You ever thought about talking with them?
Actually, I got a presentation scheduled for the Langston Hughes Health Center tomorrow,
Okay, good.
so start there. And I'm actually going back to my old school Orchard to do a presentation as well later on this month.
That's important. That's important. You create a fund aside for the education and with the outreach. And then even what I would do is have people that quit have what kind of groups we call that? A support group. You do the 8 weeks.
Yep.
You graduate into a alumni group.
Okay.
And then an alumni group could better help do outreach for what you're doing. Like even with the fatherhood program, we can better evaluate when you have children telling their dads in the fatherhood program not to smoke, and because they're key stakeholder and they're already there.
Yeah.
And we don't want to lose fathers with their children. And the smoking piece here, you could do pre and post testing from that as well.
Through the chair, absolutely, yeah.
Have you reached out to them?
With the fatherhood program?
Yes.
That's our team funds the fatherhood program, so the Transparency Project, Ron. So we work closely with them, and they offer all the smoking cessation work through our Moms First infant mortality program too, because secondhand smoke is one of the top 5 causes of infant death, infant mortality. And so this is important, and so certainly we'll continue to do all that work. The opportunity to change the environment, that's true policy in public health, and that's what we're hoping to get to as well. And
Reach out to Al Grimes as well. Reach out to Doctor. Reach out to Al Grimes also.
Okay.
They're having a big. What is this? I forgot what date it's going to be on with fathers. They're having a big symposium with dads from all over the state, and they meet and they talk. And we're going to sit down with Al, and we could talk with him about it, with children and their fathers, and because, one of the great pieces of, before all you guys time this up here, yours Prince, yours Minor, and you too, Doctor. You know, you try to play like you're older, but you're not. It's the seatbelt. What we did back in the 60s, you know, I was a little kid, they used children to tell mommy or daddy to buckle up. And they got into the schools, and we would tell our parents in the 60s and the 70s to buckle up because we didn't want to lose them. And the children helped in that fight. And when that fight happened, then they ended up pressing Congress to make it a law that for us to have seatbelts. But it was the children that fought. Just like Martin Luther King used to say the same thing when he embarrassed America down in Birmingham and everywhere when Bull Connor arrested them, sick to dogs on my people, your people also. It was the children out there that make those things happen. And the children could be a great ally to you.
Thank you. Through the chair, if okay, I've brought a couple expert testimony here. Dr. Erica Trappel from CASE, Council President, and Jerome
From
West.
my neighborhood, Council President.
And,
Case Western Reserve.
and Jerome West, who leads the smoking cessation counseling program at Metro Health. So I'll slide a microphone over to them here. If that's okay.
Now, you know where Case Western Reserve is at, it's close to, when you guys educate, the whole focus is on education. When we'll get to the other part, the risk analysis. Doctor?
Yes, good morning. Thank you for the opportunity to answer questions. I'm Dr. Erica Trappel. I'm an associate professor of population and quantitative health sciences. I direct the Prevention Research Center for Healthy Neighborhoods, which has co-chaired the Breathe Free Committee for a number of years in partnership with the Cleveland Department of Public Health. And I also lead community outreach and engagement for the Case Comprehensive Cancer Center. Councilman Conwell, you've been part of our work in the past, so it's nice to see you again and work on behalf of this issue. As has already been shared, we have been very honored to provide support for developing capacity to offer freedom from smoking within the city of Cleveland, not only here in the Cleveland Department of Public Health, but also in neighborhoods across the city. To your question earlier about the community wellness centers, we've actually trained folks at university hospitals who've already begun offering sessions at the Glenville Center, as well as Famicos Foundation, who are going gangbusters. I think as we move forward, we've been gathering all of our trainers and facilitators who are learning from each other. And so the idea you offered about alumni who are successful graduates of our Freedom from Smoking sessions will be an idea that I think will advance going forward. As has been said, though, what we know is that most people who want to quit, most people who smoke want to quit. And our goal is to make cessation opportunities as easy as possible. Not only can we offer those programs and raise awareness, but we have to think about the environment. I was very honored to be able to provide testimony in 2015 in support of Tobacco 21 legislation, where our data began to demonstrate the high number of retailers in the city, particularly how close they are to our schools, and just the overabundance of tobacco availability, particularly flavored products.
You know what, that policy intention was good, but it failed. Because before you came here, your Department of Health, they just didn't execute.
Through the chair, Dr. Trappel has some data around that.
Yes. So actually, our center, the Prevention Research Center, administers the Youth Risk Behavior Survey. This is a CDC-styled survey that we've administered locally for over 12 years to monitor things like tobacco use among our Cleveland youth in both middle school and high school. Using that data that we examined prior to the establishment of Tobacco 21 and up through 2019, we actually saw a dramatic decline in tobacco use across cigarettes, e-cigarettes, and cigarillo products in our Cleveland high school youth. That was at a greater rate than our surrounding first-ring suburbs, and that has been maintained. And importantly, as we think about equity, it actually drove down the differences by race and gender from very disparate to very close and very low. So we have some evidence. We've actually published this in the Journal of the American Medical Association, Network Open, with these results, demonstrating the very strong impact of this policy, despite, as you point out, the lack of implementation and penalty in that policy. But there was implementation, right? Notification and education of retailers, and that was sufficient. We think that that impact could have been greater, but we saw sufficient and significant impact in declining rates of smoking and tobacco use in our high school youth in Cleveland.
That's good, it's good, it's good. But you got to give me numbers when you say that, because, you know, you from Case-Western Reserve, you just can't narrate to me and say, in spite of that, Councilman, it decreased here. It could be 1 or 2%. But if you tell me and you show me the outcome measures, that's better for me. Because I don't
Absolutely.
know what you know.
So, through the chair to the committee, I will gladly send the journal publication following this meeting. I apologize for not having it with me right now, but what I can tell you is in about 2013, the overall smoking rate was probably around 19 to 20% among Cleveland youth, and it dropped to about 10% across all products by 2019. We continue to see a decline. We've had some, challenges with the pandemic of sort of understanding. We're in our final cleaning of our data from the 2024 spring administration. I will be quite happy to share those numbers with you following the session today.
Okay, and I'm gonna see the numbers. Because here's where I'm at. With me, with cigarettes, I've never smoked. I don't drink. But growing up, I was around a lot of cigarette smokers, being a jazz musician. And I play out a lot, and then they smoke, and, I ended up with cancer myself. Had colon cancer, then later it's in the GI tract, with that. Then it tried to come back through my pancreas. And I ended up losing some of the pancreas also because we caught it in the early detection. But I don't smoke, so I'm trying to figure out the cause of where it came from. Was it genetic? Or was it from me being around all those cats smoking? I don't know, but, prevention to me is the key. So before you push, Doctor, the legislation, you got to educate people, because I showed Dr. Mongolius, we went for a walk in my neighborhood, and right up the street from me, within 5 minutes, is East Cleveland. So what you don't want to do, that's where you have to educate, and I'm big on this education piece. What you don't want to do is push legislation without the education, because here's the piece. We walked. They would walk over to East Cleveland, and you're going to cause some barriers to employment also. I don't want stores closing down in my neighborhood, and I don't want, I want to save lives too. I want to save lives, but they'll walk over to East Cleveland if you don't, and same thing, and I mentioned on TV. I mean, you in Collinwood, they'll go over to Euclid, the residents. You can't tell them to stop. So that's where I'm at with the education piece.
Absolutely. So one of the key things we think about with policy is also preventing youth from initiating. What we know from our data, and this number did just pop into my head, is that less than 2% of our high school youth are using cigarettes. They are overwhelmingly using the flavored products, like flavored cigar products, Black and Milds, Fisher Sweets, some of the things you see in front of you, and vapes.
Yeah, let me
And
see
so
this.
this has been why there has been such a focus on flavor, because the tobacco industry historically has said that youth are replacement smokers. The attraction and the appeal to gathering youth as their new market is to replace those who are dying. And so overwhelmingly in the city of Cleveland, the youth here that you represent are choosing products that are flavored. So this, if we think about this also as a strategy to prevent initiation and prevent additional generations of smokers who get started with flavors and then likely move into cigarettes as they get older, there's an opportunity here, and that's why we're very aware of this. The Case Comprehensive Cancer Center is also very aware of the challenges of each municipality being responsible for its own municipality. And in fact, this past January, we were prepared to hold a policy summit and a breakfast to talk with legislators from not only Cleveland, but from the surrounding first-ring suburbs, to do some education around policy and to have a discussion about these very issues that you mentioned, sort of the crossing of boundaries and geographies, and so that everyone can sort of be on the same page about that. We were cut short with the preemption legislation that was put into the budget bill, vetoed and then subsequently overturned by the House and the legislation. So we've put that on hold, but we are at the ready, sir, to re-engage with all of those policymakers across not only Cleveland, but the first-ring suburbs to really facilitate a discussion about barriers and opportunities to pursue policy.
So let's say Friday. And you just told me something. You're saying what they did when they said no, and it was put on hold, and you stop everything, why didn't you continue to keep educating?
Oh, we are,
Education is the key, because sometimes you can't regulate things, but because you do your policy intention, the policy intention is to decrease smoking or the menthol, right? But your objective and the policy intention is you manage those. It's the policy intention versus the objection. The objection is to decrease menthol, but you stop because of the legislation.
We
You have
put
to
a-
continue to keep executing.
yes, sir. So we did put a pause on our policy breakfast because the state of the legislation was a little bit uncertain. We didn't want to bring folks together and then not have an opportunity on the legislative side. But we have absolutely continued in partnership with the Cleveland Department of Public Health to push our awareness, education, and access to cessation full speed ahead. We have been convening our trained facilitators in freedom from smoking on a monthly basis. We're working with them to identify resources through the Case Comprehensive Cancer Center to provide free nicotine replacement therapy. We are coordinating with all of our facilitators to ensure that we offer cessation in places that it's not duplicative, so that we're making access across the board. And we've already confirmed funds to train another cohort of 10 facilitators later this summer. We have focused most of our efforts here in the city of Cleveland because we see that the need is great. But we know that those facilitators will also be able to offer in the first ring suburbs where we see similarly
There you go.
high rates. So we continue to do that as well.
That's a competitive disadvantage right there. You don't want to, by me being, my background is MBA, I think about if you close it down, what you just mentioned, and you say in Glenville, if you don't educate people, they're going to walk over to East Cleveland, and I don't want to hurt the businesses in the stores. I mean, that's just where I'm at. We talked about it some months ago. Did you want to yield, Council President?
My turn.
Yeah. But when you finish, doctor, right?
Yes,
Okay, doctor.
yes, thank you.
You know, David and I walked through University Circle a lot.
Yes? Well, you should stop by and say hello.
When I can walk through it, if they're not stopping me.
Well,
First of all, thank you so much, Mr. Chair, for putting this together. And I want to just start off by saying one thing I've learned that helped me do this job is never be mad at a man or woman for believing in what they are advocating for. And that's their job, to advocate for health. However, I do want to just start by saying I don't take kindly often whenever there are, what's that?
Vaping watch.
Okay, yeah, I seen those. Yeah, but once again, you know, it's not always the best thing when I see, and with all due respect, I think that, you know, the director's a great guy in very integrity field, but it doesn't help whenever I go and look on TV and see someone politicking us saying that we are, you know, lobbying council to do something. I think that's, you know, these are the conversations that's appropriate to have, not to try to get the public to try to rally around and try to make council do something. I think that's not a good look, and quite frankly, I want to make sure that I start off by stating that publicly. However, I don't ever get mad at a person for believing in what they do. I just want to just speak a little bit out of frustration. I think that everybody comes to Cleveland and treats Cleveland like a big petri dish. I think everybody likes to come to Cleveland and see what kind of initiatives and strategies that they can come in and say that we want you to do in Cleveland, and no other inner ring suburb or outer ring suburb is asked to follow the same guidance. And what that does is it puts us in a disadvantage where we just had people to come want us to regulate salt. We just, you know, and listen, I'm the culprit in some of these. They have, flavored drinks to make sure that they, you know, that we cut back on some of the sugar with that. We looked at food. You've done some things, Councilman, in the past around health, about making sure that we follow some things, trans fat legislation. Cleveland is the most regulated city in Cuyahoga County. And everywhere I go, I just took a ride through the suburban communities this week. And there's so many smoke shops on every corner in all of these other communities. And in Cleveland, we want to ban everything, and let me say this. All I'm asking for is, why aren't everybody trying to make the same jump? Why is it always, let's go and let's lobby the poor inner city people Let's just take race out of it, the poor inner city people, and put all kinds of regulations in place. And then what we wind up dealing with is a tsunami of businesses that jump right across the border because of all of the things that we have regulated in Cleveland. And it reminds me of when I, went to, I was a garbage man for one summer when I came home from college. And I used to think that the only people who drank heavily and who did a lot of things were in the inner city. What I found out is, being on the back of them garbage trucks, is that they drank more and did more stuff, because you learn so much being a garbage man, than any inner city. But at the end of the day, people tried to relegate it to an inner city problem. And that's what, it just irks me, because at the end of the day, I'm concerned that there will be an underground market, because somebody's going to find a way to sell these. I don't know if y'all know how popular some of these things are, but there will be somebody that will step in and try to be in the market. So I just want to make sure that my concerns are not born out of not wanting to see a healthier community. I think that we want to see a healthier community. I just think that sometimes in our efforts to be correct, we oftentimes are being biased ourselves by having all these regulations and barriers in place, while other communities, which are more affluent, healthier outcomes, better choices, because they focus more on education and prevention, as opposed to saying we're going to focus on the back end and we're going to try to stop folks from doing it. Let me say this. This is a major cultural change. Back in the day, some of us used to get sent to the store to get a pack of Cools for our grandmothers. So you're talking about people that are 50 years old or so that's been really doing some things, and I understand that, we need to make some cultural changes, some healthy changes. But I just think, why aren't we focusing more on education as opposed to saying ban? Because I got a couple of questions, but I just needed to get that off my chest a little bit, Councilman, because I think people get the wrong idea that when we talk about, we're not trying to say businesses over, health. We're not saying big tobacco over health. We're saying equity. We're saying everybody should have the same, that we should make sure that if we're going to make that jump, we shouldn't do what you just said. I mean, I have a border of Shaker Heights and Cleveland Heights. Do you think those stores won't benefit and get a windfall for people that just cross the street and go over there? I mean, so I'm just concerned about some of those kind of optics. And it's part of the reason why I've been following this closely. The state law, which I totally agree with the preemption that Attorney Zach Klein has got in place, and that the city is following the lawsuit. Totally agree with that, because we need to have municipal control. But that's more so around also trying to make sure that we don't have police officers trying to enforce these laws, which we would end up with another situation potentially like Eric Gardner, as opposed to health officials. Which leads me into my line of question. Who has bans in Cuyahoga County now?
Through the chair, there are now 7 suburbs that do the tobacco retail license in Cuyahoga County. So they do regulate tobacco sales in Cleveland Heights and Shaker Heights and Euclid, just to name 3 of the 8 so far, and many more are working on it. As far as flavor regulations, there are 375 jurisdictions across the country that do it in 14 countries. The closest flavor regulation city in our neck of the woods is Toledo, Columbus, and now there are 5 suburbs of Columbus that passed pretty much within 6 months after Columbus passed their flavor regulation, which is why, we think that the flavor regulation, that if we were to pass it here, would result in the suburbs following suit. But Cleveland Heights and Shaker Heights already regulate tobacco sales more than we do, so we would love to explore, catching up to them.
Well, what I would love to do with you, Director, is go into one of these stores in Shaker Heights or Cleveland Heights, because they're still selling them. So I don't know who's enforcing it, which leads me to
I'm sorry.
the next thing is who's enforcing this.
Through the chair. So the tobacco retail license portion that they've passed is to enforce Tobacco 21. And so in those jurisdictions that I mentioned, the health department that they partner with is the county health department. They pay a fee for that tobacco retail license. What that pays for is 18-year-olds and 19-year-olds over the summer to go and try and buy cigarettes. In Cleveland, because we never passed the tobacco retail license part, which is part of our proposal we'd love to explore with you. The only enforcement of Tobacco 21 is from the state of Ohio, and what they do is they use the troopers from the Ohio State Highway Patrol, but they don't do it very often. And so even just the law passing, as you heard from Dr. Trappel, made a dramatic difference in terms of youth smoking. And so we would love to explore passing that regulation. And I do want to apologize for that one interview on television. What I've been trying to do is
What
work to
interview was
build a
that, Doctor?
coalition. It was the one you saw on Channel 5 that you were on as well.
Oh.
And all I was asking for is this opportunity. And so I'm really grateful for you. I'm not trying to arm people against you. We're in this together. We want the same things. I know who you are as a person, how you care about health, and so we want to do this together. And I appreciate you always telling me to keep going on this.
Well,
because-
and through the chair to director, I think you're a professional person, and I'm a different type of. I got a different type of style. My style is not to jump up and down, yell, and everything else. But there were some colleagues that were not happy about that. So, I represent the body,
Right.
and I just want to make sure that I go on record as
Through the
saying
chair, they let me know about that.
I just want to make
You
sure
know,
through the
Mr.
chair.
President, they called me about that, but here's the thing, and I mentioned to my colleagues, it's the education piece, and that's what you're pushing now. Even when the state reps and state senators said, no, you got to educate people, be transparent, and you have to educate them, and that's where I'm at.
Thank-
Councilman, I can't stop people from learning. People need to know.
I'm all for education. I'm just not for inequitable bans. And I want to make sure I get clarified, if I can, Mr. Chair. You're saying that those 7 communities enforce under the Tobacco 21 rules, which is we did pass that in the day, didn't we?
No,
We
through
just
the
didn't
chair,
do the
we've-
flavor portion.
No.
I want to make sure if I can get that
Yeah,
clarification.
thank you. So the clarification is we passed the law without the enforcement piece. So that was at the table in 2015, 2016.
Right.
The council at that time decided not to pass the tools part to it, but those other suburbs in Cuyahoga County did pass the tools. And so
Okay,
half
I
of the
got it.
legislation that we would love for you to consider would be the tobacco retail
Well,
license.
just want to make sure that I also get a second follow-up to that, Mr.
Go
Chair. Am I hearing it correctly that those companies that did opt in to the enforcement are being enforced by the State Highway Patrol?
No, through the chair, the State Highway
Who?
Patrol enforces throughout the entire state. But what dozens of communities across Ohio have done is pass something called a tobacco retail license, which is just like a food safety license that we do now. You pay a few $100 to the health department. It subjects you to annual inspections from our health inspectors and then spot inspections, and that would allow us to enforce the laws that are on the books. And at the time, it just, as Council, the chair mentioned, it just, the work wasn't there to be able to do that. But we're ready to enforce those rules with the tobacco retail license system that would,
And
keep
through the
law
chair,
enforcement
that's,
out of
if
it.
I could, through the chair, that's where I'm going with this, is how are we going to enforce this? Does that mean we're going to need new bodies? We're going to need existing staff? How would this actually be enforced? And the other thing I have for you, Mr. Chair, through the director, is how many tickets have we written under the current laws for people that are smoking inside? Because we have more hookah shops, more cigar lounges,
Yeah.
and quite frankly, let's be honest, we got marijuana now being sold almost in every corner in the city of Cleveland. So
Right.
this thing is getting massive. And
Absolutely.
I'm trying to understand, I don't want to just pass a law, Mr. Chair, or look at a law that's just passing it just so that I can get a headline and then send out a fundraiser letter. I want to make sure that we're passing a real law that really could be implemented if that's going to be the case. So who and how
Thank
and
you.
what is the scope that would need to be done?
Thank you. Yeah, and this through the chair. So the tobacco retail license is the system for enforcement that would not only enforce the tobacco 21 that's already on the books, it would also enforce the illegal advertising on the outside of tobacco retailers that's on the books that we had no legal room to enforce without the legislation. So that's the big chunk of our legislation that we introduced by departmental request last year is that piece. And our health inspectors would do the enforcement of that. Many of the places that we would be inspecting, we're already inspecting, but we're not yet allowed to enforce on tobacco rules. We just are allowed to enforce on the state food safety rules. So now we'd be able to enforce on that as well. And again, it's very important that it's health inspectors and not law enforcement, as you mentioned. And so we've written dozens of tickets for indoor smoking violations. Fortunately, less and less, honestly. Now the state has amended that so it includes indoor vaping, which, it's harder. People are really sneaky about their, Apple Watch vapes to be able to do that. But that's on the books now, and our team and our air quality and our environment team is on the case.
Mr. Chair, this is to me one of those things that it sounds good, it sounds like the right thing, but at the end of the day, I'm just not sure we're going to be able to enforce it. That's my biggest concern. And if I could, Mr. Chair, this is the thing that I'm really concerned about. The health department right now is the purview to oversee, food licenses. They have the purview to oversee lead testing. They have a very robust portfolio that they're overseeing right now. And quite frankly, I think due to several factors, there's some things that's falling short there, which is causing us, and I'll let her allude to it herself, that some of my colleagues will tell you that because of some of these other things that aren't being enforced, it kind of causes a visceral reaction when we try to fight against liquor licenses and other things. So I just want to the health department plays a critical role. I've always been one to try to keep a health department because I think that we have different needs in the city of Cleveland, but I just have a real problem of Cleveland just being a petri dish. And it always comes down to everybody saying, well, if you just do it in Cleveland, everybody else will follow. The only thing I've seen everybody follow when we do stuff just only in Cleveland is out the door. And that's what always concerns me, Councilman, and that's why I just want to say I got concerns. I do want to, understand equity, and I do want to say that, that we want to provide healthier outcomes. I just have various serious challenges with how this will be implemented. As the director himself just said, there are several different ways that people are having, ways to vape that will take vape pens everywhere. And quite frankly, I think that a lot of people don't know this, but the Black and Milds portion of these, the ones that have the plastic tips, are probably the biggest provocateur of pollution in our lake right now, along with bath beads. So there's a lot of different things attached to these that I understand that are wrought with risk.
Yeah.
My point is, how are we, I'm just tired in this city of passing legislation just for a headline. And then we look up. And let me say this. I'm once again, I'm really ramping up on lead. What we expected to do with lead is just not being, it's been major changes and implementations. The Residents First is doing it, but we're not getting where we need to be and blocking and tackling with the basic services now. Now here we want to try to be fancy and do something more. And in my opinion, I just don't see where the balance is. And that's what I just want to make sure that I understand. But I had to come and register my concerns because I was watching this as I left out this morning, and I wanted to make sure that I got here. That's all I have, Mr. Chair.
Through the chair,
Let me say this, Mr. President, real
before
quick.
you go? Okay.
We narrated that Dr. Margolius inherited a department of not executing. We talked about that. I always talk with him about that. You can put things on the table, and the legislation is not managed. You got to take care of me with Glenville, because that with the lead piece, I'm not happy about that. I know it's not through you guys, it's through community development, but you got to execute on that. We know that. He's here today narrating not that what you're talking about. He's here narrating is about education and how to put the implementation of a plan in place. I don't know will council pass it or not, but the implementation, and it might even make some people nervous about the implementation, but he deserves, if it's going to save people's lives. I'm a cancer survivor. Dealing with the colon as well as the pancreas. It even stopped me. I'm going to put it on the table for even some of my evolution to other areas in politics. Because of that 7-year battle. I deserve to be able to, and other people, the residents, to listen to what's going on. And if it can save some people's lives through the education process, it deserves to happen.
Councilman, I don't have any problem with the education process. The director just said that there are two provisions that he would like us to consider to legislate in order to give them more tools. So I'm responding to the things that he basically just said. Okay? I said I support education. What I'm saying is some of the things that he's asking us for, the tools that he would like to expand the legislation and scope for, he just literally said he would like to do that. And what I'm trying to understand is what our job is to do is oversight, understand, and see where the fiscal impacts would be for this.
Right, he's gonna have to do with me, because you know how I look at things, and I mentioned it earlier, I look at dependencies, where you at? Don't just give me this on the board, and you don't have any way to reach your goals and objectives. Because he and I, we walked through my ward for 2.5 miles. No, it was for 2.5 hours discussing goals and objectives and dependencies. He can say what he want, but if I can't evaluate it, then I'm not going to hear it and move in that direction. As I mentioned to you, right?
Right.
Right. But with the education piece, people deserve that. They deserve to be educated about what's going on. And I even mentioned to the director, I don't know why they stopped trying to educate people if that's something you say you want to move in that direction, because it would have gave them a competitive advantage. And I know some people don't like to hear me say that, but I can say it, and he got to do it to educate folks. And that's what we hear today.
Right.
And that means a lot to the residents.
Yeah, and through the chair, I really appreciate your comments, and I you know, as I've said to you multiple times on the phone, I want to be on the same side of you on this. I'm not here for the headline. I live in Cleveland. My roots are in Cleveland, 7 generations. You know, you know my dad now. This is not for the headline. This is about helping people quit smoking, and I know you're on the same side. And so, what I look forward to is just continuing this discussion, because I get that the health department has had some challenges in the past, but
Big challenges.
you've seen the audit from our food safety program. We just had our 5-year audit, which was excellent. You know that our lead team now is outstanding, has 0 backlog, has one of the lowest no contact rates in the state. You heard about our clinical services earlier, so we're fully staffed in environment. We're doing the work now, and so we don't want to let the past hold us back from all that we've become. I'm passionate about this. We all are. It's the #1 preventable cause of death in Cleveland, and so the Petri dish comment, I hear you on that, but at this point, 375 cities have passed some form of this legislation, and so we
They
just want to
probably
keep the
was
conversation
executing.
going.
You inherit a culture of no execution. They probably were executing. You have to go way back. If you look at the background history of Columbus and other places,
Yeah.
they were executing. You inherit a culture of not executing, which is in Desiree. So
Yeah, and
You
through
got
the
the
chair,
baton, you gotta
just
work
like
it.
all the departments, right? We just want a chance to prove ourselves, and we're not going anywhere. The only urgency is that new people continue to pick up cigarettes or flavor vapes for the first time, but we'll keep doing the education, and we want to keep the conversation going and keep the door open for the conversation now that the state, at least temporarily, has a restraining order against preempting us. So we appreciate your comments, and we just want to be on the same side as you on this.
Any more comments, Council President?
Only thing I'll say, Mr. Chair, is whenever we vet stuff, I just hope that we're also looking at implementation. One of the things that we did with the Lead Safe initiative is that we did not just try to pass the legislative side, we also talked simultaneously about the implementation side. And, hear you, Director, I never had a problem with your professionalism. Said what I needed to say about the political side, but I will just say this. I just am really getting to a point where everybody comes to Cleveland and is like, we're going to fix Cleveland if you guys just ban salt. We're going to fix Cleveland if you just ban these things. If we're going to, Cleveland is going to be healthier if we just stop this. And what I'm saying is, I continue to hear that day after day, and everybody pitches that, and then they go, and sometimes they're not even from our city. And they come, and then they come and they put in a nice, beautiful packet like this about how they came to Cleveland and made Cleveland City Council do something in order to make Cleveland healthier, and then they go and they sell it, and then they get a grant. And then talking about education, Councilman, a lot of times we get no funding, no support, or nobody's out there and we look around and everybody's saying, well, I thought y'all banned this. Councilman, why don't you stop them from selling them cigarettes and stop them from doing that? And then it's going to become our problem. And it's going to become our solution to solve about how we do it. And it's going to be another thing that we got to deal with from business owners talking about, you know, how they are being treated or whatever else like that. So all I'm saying is, at the end of the day, all of that stuff comes back to council. And I think some of us are just getting to a point now where we want to make sure that what we're passing and what we're doing actually is going to be followed through and implemented. Simple as that. And it shouldn't always just be, we're only going to do Cleveland, and then everybody else is going to follow, because I can tell you I passed several laws over the last 10 years and over the last 30 years, and that was the same thing, and some of these suburban communities never adopted, or we can't get the county to go and say they're going to put up something.
Yeah.
That's all my concern is.
Yeah, that
Thank
is
you.
true. That is true. And David, Director, before you even came here, we have passed a lot of laws in the health department, building housing. It sits right on the shelf.
Yeah.
But I like the education piece. Even if the law is not there, you're educating people, and you're getting people to look at this, because a lot of us, we need that education. Education is the key. And then we'll see, are you hitting your benchmarks? Then for the implementation, then you come back to council and say, this is where I'm at. But what they'll look at with the council president, you inherit this, because it's some other people have talked with me, not even on council, but they downstate about the health department that you inherited. I mean, they lost millions of dollars in the health department, so people don't have faith in the health department, so that's just what you inherited. You see what I'm saying?
Through the chair, yeah, I appreciate that, but that was the distant past, and the people who are there now, some of them were there then and were held back from being their full potential, but they're incredible people there now. They're all watching. This means a lot to them that we get to at least start to have this conversation. We do have an implementation plan for how this would work. Part of it, the biggest part is this education piece. These are two full-time health department members here with you today, council president, who are doing this work. Obviously a widespread coalition of folks in the community doing this work, and so we would be honored to present our plan, just to have the conversation, so you can see that we really are. This is what keeps us up at night. So we're thinking about this, and big tobacco is tough, right? I mean, we've had these conversations. It's really tough, but I think that that we can really make a difference here, and we want to be on the same side on this.
You know what, but when you show your plan, and I'm listening to you, and I'll yield in a second to the council lady. Will you finish, Council President?
Yes.
When you show your plan, show that you hit some milestones. That's where I'm at. Because, the council president, he knows my behavior, he's been knowing me forever. I got to see milestones that is being hit, and then that way you're able to get other key stakeholders on your side when you do that. And when you talk with other council members and legislators, you got that on your side. But you got to hit that. I mean, just showing me a plan means nothing to me.
Okay.
But when you show me that here's our plan, and these are the things that we've done, and here's the risk. The risk, the council president is right, because you and I, we went for a walk on that risk, and we talked about it. University Circle is right next to East Cleveland. Cut it off at University Circle, they go over to East Cleveland. So that's where I'm at. Council lady?
Thank you. Through the chair to the public health team, good morning and guests. I guess I'm just listening to the conversation. It's a lot happening. So I'm going to put out a request. I really feel like we need to just have a moment beyond our committee hearings to actually sit down to have some strategic thinking coming together, because there are a lot of things happening, right? So as we have had, I do want to follow up and thank Commissioner Lita Wells Wills. Oh my goodness, I'll be killing our commissioner. I got it right. Commissioner Lita Wills. She invited me out to the in-service day during National Providers Day for our practitioners around Moms First. It was so. I think it's needed, and I know a lot of varying different partners, our departments and divisions within the city of Cleveland need to take time to pause. Like they paused the work, the providers got together, and they were thoughtful to look at a variety of things, actually getting support, getting care, but also identifying the framework that we are utilizing, right? So me and Councilman Slife are on the executive committee of Racism as a Public Health Crisis Coalition Committee. And there is so much work when we think about the framework. And so this is where my request comes from. Again, there's an intentional reason why I'm saying we need to take a significant amount of time, and I'm significant in our times, meaning at least a day, to be able to think through some of these things in a more comprehensive and strategic manner. The reason why I'm bringing this up is because Friday, I sat about 2 hours in a liquor hearing, and it was very clear to me why, and a question, this is a question through the chair to the director. Does the city that you know of, do we have strategy meetings with public health, building and housing, public safety, law, and council for looking at how to improve conditions in problematic areas? Do we actually do that here in the city of Cleveland?
Through the chair, yes. Yes, we do.
We do. Okay, through the chair. Okay, well, I would love to be a part of that, and I'm gonna, through the chair to the director, because I've never been a part of one, right? And my experience on Friday had me questioning who's doing it, why doing it, and when we are, well, something was missed, I would say, for Ward 7. And I'm this case specifically when it comes to the Family Dollar on 74th and Superior, where for the last Monday I went in there to take pictures. Friday during the hearing I went to take pictures, and trying to say that I don't think they earned the whatever the C1 liquor license with the beer and wine beer license to move forward. But a couple of, not even 2 months earlier, they were they got a renewed license for food retail in a store that is absolutely disgusting. And I don't know how that works when it's like I'm trying to at least limit the harm that's caused, you know, having an excessive amount of police calls, over 100, that go to a store. And again, I think that's part of the issue, and I'm bringing it to this conversation where, in some regards, again, I am a person, I know we need to do all things because there are systematic policies that have created the conditions of what has been educated, what has been targeted, and what has influenced behaviors, right? Listening to the disproportionate amount of tobacco usage, which in our communities. At the same time, there are basic health issues that are going on that are clearly not in coordination. And when you sit in this seat, it is very hard to sometimes consume and look at some of the larger holistic things when some of the things in the today are not being properly addressed. And so it goes back to my original thing of like, we really have to take time to be much more strategic, because again, in my mind, and going through this experience on Friday, there's no way that a place like 74th and Superior, the Family Dollar, how could it even possibly be renewed a food retail license when it is in the deplorable conditions, right? And these things happen not just there, it's all around the city. right? And if we don't have a strategy in place to think about comprehensively, not just one department, but all the multitude of levers, what are the different leverages that we could get people to have more respect and care in our community, right? It is not happening to the tune that I would say is acceptable in Ward 7 and throughout the city of Cleveland. And for whatever is happening, there is clearly some blind spots, mismarked, because it was very eye-opening to me on Friday, sitting there, and I'm like, this is why we will never be able to have victory, because we don't have no strategy in place. And yes, I will give a shout out to Kevin Roberts, who is doing so much on the solo, right? It was me and him. But again, when you're looking at the lack of connection in how we are issuing the licenses and things of that nature, not getting people to follow along with our basic Cleveland ordinances of just basic sanitary. And then, and following up, just when we're having this tobacco conversation, I was sitting somewhere and I called Councilman Conwell, was it that day or the next day? It was over the weekend, and I was sitting somewhere, it was actually on Superior, and I was like, what is this? Because I was just watching people go in and out of a place, and some of the people you knew didn't belong there, right? This ain't their neighborhood. And I was like, this a weed shop. A cannabis shop. It's clearly that case. They pop in on Instagram, and I was touching base, but I got the chance to talk to the county councilwoman, not the councilman. They are aware of it, and it's just like, what we doing here? And again, so it's a lot of things that are happening right now, and I'm saying this is literally today, Monday. This was from Friday. The one other thing was Saturday, and we here on Monday, and I am a person that absolutely can be supportive of what is being trashed as far as the ban of menthol. Within that, though, we have got to get our arms around true enforcement in a comprehensive fashion, because our rules and laws are only as good as how much that we can actually enforce and carry it out. And I think there are, in some respects, there are some places where we are just not meeting the mark. So to say, hey, we're going to add something else, it's like, how do you get good with the things that we are supposed to be doing before we add it up another notch, right? And now that's from my perspective, right? And I also think, even from my colleagues, of like, we want to get there, but how do we get there when there are some things that are clearly being missed the marks? And hence, there's another thing. It says a sign, because people were calling me about another marijuana dispensary, cannabis right here. And I was like, what are you talking about? It's a building, again, at Addison and 79th, which is a building, has a lot of building and health violations, but I'm like, between health and safety, the public health and building and housing, like, it's all of these different things that are happening all at the same time that we must work to enforce. And again, this is why I'm saying having a very clear, significant amount of time where public health, building and housing, public safety, the law department, and whoever is the applicable, council person, this is going to be our process, and this is how we can enforce things, can go a long way to building confidence that we will be able to effectively execute on the things that we are putting in place, because it's just not meeting the mark. Yeah. It's not. So, thank you.
Thank you very, very much. You inherited. You got the baton.
Well,
and like even before you came here, with environmentals, I called the commissioner for several months. Never returned my phone call. He looked up in his office. Press was about Glenville. He looked up in his office, and I had to tell the commissioner a few words. Like, how you gonna have a councilman call you several times, and you not return his phone call? Because the residents were jumping on who, Council President? He was wearing us out, man. Wearing us out, wearing me out. He doesn't return. But you, I'm not saying,
Yeah.
I hear your subordinating conjunction. I want you to do the education piece, but it's how, it's always background history. They called me too.
Right.
The council president getting with other council members, like, how can Conwell listen to that? And we're getting beat up on other,
Yeah.
isn't that true? We getting killed on other
But
issues, but
to the chair,
I
can you
wanna
share your
listen to
Family
this.
Dollar? Can you share your Family Dollar story from your neighborhood again?
oh, yeah, man,
And
our
then
Family
the
Dollar-
Family Dollar that we sent the pre and post to you about the cleaned up Family Dollar.
Chair, can I say this? It's
Yeah,
not-
yeah, yeah,
please
yeah,
don't,
I yield.
please, Mr. Margolis, we not, actually, I think you ought to take solace that everybody appreciates that you're trying to provide some leadership around this. The frustration is, and I'm just being honest with you, this council is tired of passing things that there is no clear, as Councilman Conwell always says it, path of how we're going to actually see some things happen that's going to reduce. He just talked about HUD, and he talked about how he got a $10 million grant.
$11.2 million.
$11.2 million grant that we worked our butt off to try to make sure that Glenville is led safe. There should not be one child in Glenville that hasn't had the opportunity to have their house remediated and have it led safe. But we're not hitting the benchmarks. So it's hard to keep on passing things and adding things. Councilwoman House is saying the same thing. You do respond. You responded when I've had issues around, things at houses and other things like that. This ain't personal. As I started off this conversation, nobody gets mad. I don't get mad at people who are passionate and believe in what they believe in and are here to advocate for what they're here to advocate for. We just, unfortunately, have different things that we have to look at, the big picture, when we're actually trying to deliver services. Because as Councilman Conwell says, you're not going to get the calls from all these folks. We're going to get the calls. Councilman, why did you guys, get banned cigarettes? Now all they're doing is selling them over at this weed shop down the street. I mean, those are the kind of factors that we get. The biggest factor I got this week, which is why I was riding the neighborhood, because literally, as Councilwoman House Jones just said, there's a weed shop on every corner now. And they're not even following the signage.
Right.
And then I thought it was just Cleveland, and I rode through the suburbs, and it's even more in the suburban communities.
Right.
So my point is, as Councilwoman House Jones saying it so eloquently, which is the concern about this is more strategic than to just say, let's pass this piece of legislation and we're going to deal with Cleveland's problem. And Cleveland's problem is a lot bigger than Cleveland, because you know what, Mr. Chair, and all my colleagues, people come to play, they come to pray, and they come and use Cleveland for all the things they want to do, but then they go lay their head down in these suburban communities. Half of the times when you look at the crimes that are taking place, or you're looking at those people that Councilwoman House Jones just talked about coming in and out of those stores, it's because they don't want to be embarrassed by going into them in their own neighborhoods. So I hear your point, but my point is this is so much broader. And so the scope is so big, and I'm tired of just passing piecemeal legislation and not having comprehensive ways that we look at this, not just from my neighborhood and his neighborhood and just Cleveland in isolation, but everybody wants our assets, but nobody wants our problems. And that's my concern. And that's why I'm a little frustrated, because every week we get salt, sugar. You're gonna make everybody healthy, and then they pass these things, and then they go get a grant and tell everybody on some fancy presentation about how they help Cleveland do their things. Now, I'm always about stats. If somebody could show me, like Dr. Trepper here, that's what I'm about.
Right.
I made up my mind this weekend. I am not passing any more legislation just for a headline. Just being honest with you. So I just want everybody to understand that. Anybody that comes to the table, we expect outcomes. That's all, Councilman.
Yeah, I'll come to, Mr. President. Just like when we look at this is a sidebar, when we look at the recreation, all right, they want to pull it out of Public Works. So we went through that before with building the housing when they took it out of community development. And I discussed with Dr. Margolius, the intentions may be to go here, but the outcomes could be that people are walking and going over to East Cleveland, Shaker Heights, whatever the case may be. So we start educating. He builds a case through the education of people. You got to do that. Then you're able to build, after you build your case, then you go to the implementation of a policy. because you just don't do the implementation without building a case, and that case is work. However, you inherited a bad department, man. I'll tell you offline who was in my ear about it. One of the big guys in the state was in my ear about it. And
5 years ago.
yeah, it was some years ago, but they were losing millions of dollars.
Yeah.
And the thing is, the council president was the chair of public health. Isn't that true, council president? They're losing millions and millions of dollars every time we turn around. So it's the trust in the department that you inherited. Now, with Family Dollar, Mr. President, I called Director Margolius up. I walked into Family Dollars, and it was trash and debris everywhere, the one on 105. I told the manager, I said, clean it up. I didn't tell her because it should be that if Minor come in, Prince, whoever come in, you tell this lady to clean it up, she should clean it up because she's servicing the community.
Right.
She told me off badly. I called Dr. David Margolius. They met at my house the next day. We went to Family Dollars, and then that got on the list to close down. The residents were disappointed that it had to close down. However, it was vermins in there, it was unclean, trash and debris, and this man executed right away. You did the same thing with Park Place, and that's why I'm here right now today, because you showed me some things that I believe in. At Park Place, Mr. President, we visited them. It was children that had to deal with vermins in the house at Park Place. It was mold and mildew. It was all kind of abject poverty. I reached out to Dr. David Margolius. He met me in my house. We walked over there to Park Place. Then you had a meeting down with the former Congresswoman, the head of HUD. I went over to HUD, talked with them. They had a grant coming to Park Place. They took care of that, and that's how we got the $11.2 million. I just didn't mention it to you guys. We was the National League of Cities. We were executing on that. However, it was Dr. David Margolius that was working with me, and now when you pass by Park Place, they're there working to, and Park Place even called you. About 50 children was over there and living in that kind of mess. So if you reach out to him, he has shown me that he would execute, and so I'm here today listening to Dr. David Margolius. He deserved a chance to my colleagues. It's just that they're not upset with you. They're looking at the background history, and you have to look at the background history. Things that have been passed, and it's just the health department just, you inherited it.
Yeah,
You got
no,
the baton.
And through the chair to the council president, I do take it personally, and I know I shouldn't, but these folks show up every day to work for the city of Cleveland, to work for the residents, to improve health in our community, and they do great work. And I really appreciate them, and I hope you'll give us the chance to earn your trust and earn the city council's trust to be able to execute on these plans.
And I got to say this also, was I was upset with the health department. When I was on the health committee and council president chaired it, they got rid of majority of the African Americans, Prince, over at the health department. You remember that, Mr. President? Majority of African Americans, and I asked you when we went for a walk, were you going to bring back some African Americans? And you told me that you would do that. And I asked you, would you put them in key positions? And you said that, and I see that also. So it's kudos for that. They gutted it out. They got rid of a lot of African Americans. And then you're going to try to pass racism as a public health crisis, and at the same time, you just letting your African Americans go. You taking them out. You just taking it out. You're diverse now, but back then it was not diverse, and you did that. So you got a lot of people who, but they haven't worked close with you like I have. Like I call you late at night or whatever, and we work. So it's the trust. And you inherited. You got the baton.
Mr. Chair, I just want to make sure that I've learned that I'm going to clarify the record every step of the way.
Yeah.
This has not ever been about anything with the workers or anybody else that's working to do this. Once again, as I always state, I never get angry at a person, a man or woman who's here to advocate for what they're here to advocate for. But I ask people to respect mine and respect that I got different angles and I got multiple streams that people are advocating for me too. That's all I'm saying. I don't want to make this seem like this is an indictment on workers. I don't want to make this seem like, Blaine Griffin want all black people to die because he won't ban cigarettes. I just want to make sure that we point out and illuminate facts that we feel are necessary to consider as we have this conversation. And I want to make that clear because I never pick on employees. I mean, I have a problem with a director, and at the end of the day, to be quite honest with you, the way that I try to perform is as 18 elected officials, I try to relegate my debates between those 18. But I will tell you that that's why I try to tell directors and everybody else, let 18 politicians be 18 politicians, so then that way you don't get caught in crossfire, because your job and their job is here to advocate for what you believe is best to help us make informed decisions about the health and equity of people in Cleveland. Never have a problem with that. I just have a problem when people don't respect that we got multiple streams of information and people that we have to manage throughout this process too. And at the end of the day, we do want to get an outcome that the community will be satisfied with, but not have inadvertent impacts that none of us will be able to control at the end of the day. That's all we're trying to make sure that we have that kind of conversation for. Thanks, Councilman.
Thank you, Council President.
Through the chair, I would love the chance for Jerome to
Oh, sorry about that.
give a
Yeah,
little
you
testimonial
felt
about
it
his
too.
work. I appreciate it. Thank you. He's been sitting here patiently.
Good morning, Council. My name is Jerome West. I am the program manager of the Nicotine Dependency Prevention and Treatment Program at Metro Health. I came to Metro Health about 2 years ago, and I looked.
Steve.
What's that?
You were doctor.
No, I'm not with Dr. Sigi. I came there about 2 years ago, and I recognized that there had to be done something about the impact of smoking in Cleveland. They had a program that was around for 20 years, and it was good, but it wasn't great. So we began to look at smoking in Cleveland. We recognized that it's tied with Detroit being #1 in the country. We recognize that smoking isn't just something that is easy to get a quit and stop, that it is truly an addiction. As an addiction counselor and also as a Ohio Certified Prevention Consultant, I understand the importance of prevention, but I also understand the importance of addiction also. And we look at our patients now. I'll tell you that I serve several hundreds of your constituents in this community. And I'm reminded of this one lady. She's 70 years old. She makes $900 a month. But she says, I spend $200 a month on cigarettes. I spoke Newport menthol. She says, I want to quit, but I can't quit, Jerome. I've had over 15 quit attempts, and I can't quit. And she says to me, I try and I try, but I can't. She's made some progress, but that's only one story. One story, she's made some progress, and we've worked down to 3 cigarettes, but she just still is struggling to let those 3 go. Then there's the other patients that I serve that one guy, he quit in 2 months. He was smoking 30 years. To see the success and see the struggle of some of these people. I have one other patient, as I remember, she has half of her lung removed. How do you have half of a lung removed? And every morning you wake up, the first thing you want is this cigarette that's going to take 11 minutes off your life. And if you want to know who my constituents look like, they look like me and you across this table. Majority of my constituents are African American women. I would say about 45% of my patients are African American women. So I understand the history and the political side of it, but I also see the pain of nicotine addiction. Lady has been smoking, she's 70 years old, so I've been doing it since I was 12, and I can't quit. So that's what I hear and that's what I see. It is a mean addiction that slowly kills people slowly. It starts off with COPD. They get parts of their lungs or whole lung removed, and they slowly wake up every morning with COPD and they can't breathe. It is a sad day sometimes in my office. So that's what I wanted to share with you and put a face to it and know that this service is, that smoking nicotine addiction in Cleveland is at an alarming rate, and it's sad. Thank you.
Thank you, young man. So you'll show me your education plan, your director. You build your case to the education and do your implementation of that. And then once you show your plan and you move forward from the implementation, then you move towards your planning. You're not even got to your planning part of it, of your legislation at all. But through education, you could build your plan, you know. And you also got that background history. You mentioned that was 5 years ago or whatever. But anytime you do a strategic plan or whatever the case may be, or you build a case, it's always background history. Because you got to deal with the background history, because you move from that to the building the case to the implementation of it. Because people get nervous when your background history was not a history of execution and it wasn't efficient. But you inherit that. I mean, that's why they brought you in. That's why you make the big bucks, doctor. So I'm there, I'm listening to you. We work close together and everything, all right? We'll meet for lunch and stuff.
Thank you.
Any other question on the education part of tobacco with the menthol? Saying that, the Health and Arts Committee is adjourned. Thank you.